She had a really simple appointment, and she came in and she was really upset because one of her blood tests was off. So her blood test was off, and they told her, oh, you have leukemia, go see the cancer doctor. So she went to see the cancer doctors, and they redid her blood test. They're like, no, you don't have leukemia, your blood test is lower. Go see the lung doctors, you've got spots on your lungs. So she had an abnormal chest x-ray. She had to wait and go see the lung doctors. Then the lung doctors were like, you need to have a CT scan done, maybe you have cancer. That's the story. So she comes in and she's kind of frustrated, and this is going on a couple of months now. So about 2 months ago, her primary care doctor told her, you may have cancer. So she's planning on telling me she's DNR and she doesn't want to have chemo and all that stuff. I said, whoa, hold on a second. We don't know that you have cancer. Sometimes if your lungs are bad and you've been smoking as long as you have, you'll get these funny blood counts because your lungs aren't oxygenating properly. And I'll tell you what the problem is. Our healthcare system has really changed, because when I was a kid, we took a look at you and said, listen, we're really worried about your blood count. Go to the hospital and get admitted. And we would admit you, we'd put you in the hospital. We want to find out what's wrong. This was when we were allowed to do what we wanted to do, when we were allowed to take care of patients, when insurance companies would pay for what we said was necessary. So you'd be admitted to the hospital after the primary care doctor looked at your blood, because your blood was abnormal, and the next day the cancer doctor would come in and the lung doctor would come in, and the day after you'd have a CAT scan done and you'd have an MRI done, and the next day the cancer doctor would do a bone marrow biopsy, and the next day the radiologist would do a lung biopsy, and in 3 days you would be done, and they would discharge you and they would say, you don't have cancer, we checked it all out, or they would say you do have cancer. And we were wasting money. It was very inefficient, and they put an end to that. And that's because doctors were in charge and we wasted money, but it was compassionate, and it was we're taking care of people, because now we tell you maybe you have cancer, and then 2 months later we still don't know. And that's just an awful system.